everyone, welcome to our vlog. So now, I'm Elagine Sinugas.
Hi, I am Katrina Tiurag.
And I'm Clarice Lipata.
We are going to talk about effects of the COVID-19 pandemic to the different social institutions, such as
Family,
Economy,
health,
religion,
and education. So now, let's discuss it.
I am here to discuss the effects of COVID-19 in the family institution. It could making big changes in everyday routine due to financial hardships. For other families, it could mean raised anxiety in children, tension in parenting relationships, or general fear. Finding the new normal in this time of pandemic, parents should be talk to their children about COVID-19. It's important to first and foremost ensure that you have an open and supportive environment where children know they can ask questions. However, it's equally important not to force children to talk about things unless and until they're ready.
how does the COVID-19 affect the economy? COVID-19 is not only a global pandemic and a public health crisis. The global economy and financial market have been also seriously affected by it. Large income declines, increasing of unemployment and disturbance in the airport, utilities and manufacturing sectors are among the implications of the disease control measure introduced in many countries. The virus has not only been a public health issue but also shaped the global economy. According to the World Health Organization or WHO, due to the decrease of productivity, loss of life, company closures, trade dispute, and deterioration of tourism industry, major economic impact has already occurred worldwide. The economic impact of the COVID-19 pandemic will be similar across in income distribution of the country. In addition to marked health inequalities, particularly in countries without universal healthcare coverage, during the restriction, office workers are more likely to move to flexible working arrangements, while many industrial, tourism, retail, and transport workers will be suffer significant decrease of employment due to the community restriction and low demand of their goods and transport.
Now, let's talk about education, the effects of the COVID-19 pandemic and education. The COVID-19 has changed the world, especially its effect in our educational system, leading to the near total closures of schools and universities. Most governments have temporarily closed educational institutions that schools closures impact not only in students, in teachers, or in families. Because of the changes from face-to-face learning to blended and distant learning, or what we called in online class or in a modular, it can through alternative ways to use to avoid face-to-face interactions where students and teachers had access to electronic devices and reliable internet connections. Learning management systems such as Canvas, application in Google Meets, and Zoom that we used. Another one, the modular distant learning, where it hand over the printed modules by the teacher to the guardians of the students once a week. We've also seen profound challenges in those students lack in devices and also in internet access to be able to participate in online classes. And there's some schools do not have the capacity to teach online. Most of young people experiencing it, right? Many families are struggling to support home learning, whether because of their condition in the housing, their work, or caring responsibilities. Most of young people experience it. It can be also affect in our health, either in physical, emotional. You can be experience struggles because of the workload of online classes is larger than it in regular class. Most of the students reported the online class has to be even more stressful than regular classrooms. As a student participating in home learning program or what we call in online class, it was confusing to adjust to we had not been prepared through stimulations or practices beforehand.
The effects of COVID-19 in the health institution. It is becoming clearer that the effect on COVID-19 upon healthcare system goes beyond the disease. It produces as health system have to somehow contemporaneously cope with the existing levels of non-communicable disease. This is an enormous challenge since in all too many cases, the system cannot cope with the volume of patients needing care as a result of COVID-19, even if there were no other causes associated with cardiovascular, pulmonary, and metabolic diseases and cancer. The effect of this has varied by country to country, but some patterns are emerging.
Religion plays an important role in everyday lives of the people in the nation, like Philippines, where 81% of it is Roman Catholic. But because of the COVID-19 pandemic, church masses need to be cancelled to ensure the public safety due to the government lockdown policies. However, this put a lot of pressure in so many individuals who, in time of the health crisis, seek for faith and guidance. The value of spirituality and healthcare has been shown by study as it brings peace and meaning to people. A more proactive form of healthcare requires a physical manifestation of disease and mental suffering. As such, pastoral care and other spiritual service are an important component of everyday life and health care. Hence, Catholic churches have taken steps to include online churches masses, group prayers, spiritual recollection, retreats, and Eucharistic worship and precision to the public.
Hi, I'm here again. So that's how COVID-19 affects to the different social institutions. I hope you learned something from us, and that's all. Thank you for watching.